Respectful drug screening, using drug screening as a tool. Information in this presentation is courtesy of SAMHSA's Tip 43, Medication-Assisted Treatment for Opioid Addiction and Opioid Treatment Programs. More information about Tip 43 can be found on SAMHSA's website. Throughout this training, participants will learn the purpose of respectful drug screening, the approach for respectful drug screening, the frequency recommendations of drug tests, how to handle results, and falsification. Drug screening is recommended for all integrated addictions care participants as a means of informing treatment and monitoring the effectiveness of our services. Patients should be encouraged to discuss their substance use with their treatment team and to trust them with this information. Ideally, once trust has developed, drug screening results will confirm what already has been revealed in individual or group sessions. Indicative of continued substance use should not be used to terminate treatment, but rather to make changes as needed. However, those changes to their treatment plan due to test results should not occur based on a single test indicative of continued use. For patients in short-term detox, one initial drug test is required. MAT patients are required to have initial and monthly random tests. For patients in maintenance treatment, SAMHSA recommends a minimum of 8 screenings annually. More frequent testing should be performed earlier in treatment when the patient is working to stabilize rather than later. Frequency should be based on progress in treatment. Results should be documented in the EHR and should include outcome, subsequent changes to treatment and justification, patient response, anything impacting results such as prescription medication, or signs of falsification such as a sample that is out of range for the temperature. Informed of screening results as soon as possible and should have an opportunity to discuss these with their provider. A patient who refutes test results should be taken seriously, particularly when the results are inconsistent with the treatment profile and progress of that patient. Providers should use drug test results clinically, not punitively, for guidance, treatment planning, and dosage determination. Respond rapidly to relapse indications. Ensure that results trigger treatment, relapse prevention counseling, HIV counseling, and other intensified interventions. Continued use of heroin or other opioids and possibly other substances should generate a review of a patient's addiction medication dosages. Results should be used to explore different levels of care, interventions, and treatment plans that will reduce and eliminate substance use and improve treatment compliance. Reports indicating substance abuse should signal the need for a medical review of medication dosage and for intensification of counseling and education aimed at preventing HIV and hepatitis transmission. Results indicating continued use should receive more frequent random tests. Increased testing provides greater protection to patients vulnerable to relapse because only short periods pass before a therapeutic intervention can be initiated. Falsification is reduced when patients understand that test results are not used punitively but to inform treatment. Begin building trust with your patients early in treatment by talking about the purpose of testing and encourage them to ask questions.